Hi, my name is Allison Crabtree, and with me is Tammy Morrow. We have created a presentation for NU 712 Clinical Prevention and Population Health. The title of the presentation is Breathe Easier, a community-based program for patients with COPD. This PowerPoint will explore the impact of COPD on the health of the nation and highlight a DNP-led interdisciplinary community-based program designed to improve the quality of life of program participants.
Included in this presentation is a table of contents found on the next two slides.
The objectives of this presentation are listed on this slide. Please take a moment to review them. COPD is a crippling lung disease that over time takes away the capacity to breathe. Most people who have COPD have a combination of both emphysema and chronic bronchitis. Some people with asthma also develop COPD because of the long-term inflammatory process that tightens the airways. In COPD, airflow is restricted because the air sacs become less elastic and work inefficiently. The walls become thick, inflamed, and clogged with mucus. Because of these factors, there is impaired gas exchange, causing retention of carbon dioxide and decreased oxygen levels.
The most common signs and symptoms of COPD are constant cough, shortness of breath, difficulty taking a deep breath, excessive sputum production, and wheezing, which is a high-pitched musical sound that is caused by inflammation and narrowing of the airways.
COPD affects 1 in 5 Americans, but there are millions more who may have the disease and don't even know it. COPD affects women more than men and older individuals age 45 and above.
Historically, COPD was thought to be a smoker's disease, but research is finding that up to 1/4 of cases involve people who have never smoked.
In the United States, COPD is the 3rd leading cause of death and 4th leading cause of disability. COPD is the only disease in the leading causes of death where death rates are not declining. These staggering statistics prompted Congress to contact the National Institute of Health to address the burden of this disease.
As a result of Congress requests and input from the broad COPD community, the first ever national action plan was developed. This action plan represents a unified fight to reduce the burden and impact of COPD in the United States.
The COPD National Action Plan has 5 goals, which will be used as a framework for the development of a DNP-led healthcare initiative. Please take a moment to review these goals highlighted on this slide. This slide introduces a small-scale intervention that can potentially have a large impact on the local community. Let us share with you our plan. Breathe Easier is a DNP-led, interdisciplinary, community-based program that aims to improve the quality of life of program participants.
The proposed site of implementation is a former hospital that was acquired by Jacksonville State University to be used as a resource for health-related educational programs and community engagement.
Multiple JSU programs such as nursing, respiratory therapy, social services, dietetics, kinesiology, and exercise science will join together in a collaborative approach to meet the needs of the COPD community.
Breathe Easier is a novel approach to supporting those affected by COPD. The program is comprised of a 6-week educational course targeted to improve quality of life, decrease complications, and manage the chronic pulmonary disease.
During Session 1, the interdisciplinary team will be introduced to the participants. The goals of the program will be outlined and an overview of the disease explored. Collection of data will begin in Session 1 as the DNP leaders measure the effect of COPD on participants' health and quality of life using the COPD assessment tool.
During Session 2, the goals will be to teach the participants about the importance of medication adherence. This session will begin with an overview of commonly used COPD medications. The participants will be educated on the indications of use, the mechanisms of action, and the possible side effects. This will be communicated in lay terms. One of the most important aspects of this session will be educating the participants on proper usage of medication delivery devices.
Participants will be educated that COPD is usually treated with a variety of medications and that treatment decisions are typically based on severity of symptoms. They will be educated on the need to individualize treatment plans based on a number of factors. Some of the most common medications highlighted during this session include short-acting inhaled medications used for rescue or acute symptoms, and long-acting meds that help control symptoms and exacerbations. The educator will highlight some common medications used to decrease thick mucus and explain that during exacerbations, add-on medications can be used for a short time to improve lung function and prevent complications. The overall goal of this session is to help participants gain an understanding of the importance of adhering to their individualized plans of care and to gain a deeper understanding of the reasons a variety of medications may be prescribed to control or prevent symptoms. During Session 3, there are 3 main topics, including smoking cessation, immunizations, and nutrition.
According to the CDC, 75% of patients with COPD are smokers. Smoking cessation is the single most cost-effective intervention to stop COPD progression. Therefore, strategies including counseling, support, and pharmacotherapy will be utilized during Session 3. Avoidance of secondhand smoke will also be stressed.
Patients with COPD should be encouraged to receive appropriate influenza and pneumococcal immunizations. According to CDC, these vaccinations decrease the incidence of lower respiratory tract infections.
Clients with COPD often have nutritional deficits. A client's nutritional status is reflected in the severity of symptoms, degree of disability, and prognosis. Nutritional assessments are important for clients with COPD because significant weight loss and malnutrition are common with advanced disease. The importance of a healthy diet and nutritional supplementation will be discussed during Session 3.
Session 4 will be focused on providing participants with ways to manage the disease process. Participants will be exposed to techniques aimed to improve their quality of life. These include energy conservation, activity pacing, managing fatigue, and improving physical conditioning through individualized exercise routines.
During Session 5, participants will walk away with an individualized written plan of action designed to assist in managing symptoms during acute exacerbation. This plan will also include parameters for determining when to report concerns to their healthcare provider.
Exacerbations can profoundly alter the course of the disease and impact the patient's quality of life. Therefore, education is vital to prevent and or avoid severe complications such as pneumonia, hypoxemia, and increased mucus production. Complications can lead to lengthy, expensive hospitalizations and further deconditioning for the patient with chronic pulmonary disease. In the final session, participants will be introduced to and provided information on a variety of community resources. For example, social services will be discussing advanced care planning. Other community resource representatives from home health care, counseling services, medication assistance, and durable medical equipment suppliers will be available to answer participants' questions.
At the closing of the session, a COPD community support group will be established for ongoing patient and family support. Participants will be encouraged to be active leaders in the community support group after program completion.
The data collection survey will be re-administered at the conclusion of the program. Previously discussed, the collection of data will be accomplished using the COPD Assessment Test, or CAT for short. Pre- and post-test measures will enable the DNP leaders to evaluate the impact of Breathe Easier on the participants' health and quality of life. Data will also be used to make adaptations to the program for future sessions.
The CAT is a valid and reliable 8-item patient-completed questionnaire developed for routine clinical practice to measure the health status of patients with COPD. The tool was designed to provide a framework for discussions between patients and their providers to gain a deeper understanding of the impact of the disease on their life.
Breathe Easier participants will be encouraged to share these results with their healthcare providers in order to partner and develop individualized treatment strategies to improve symptom control and increase quality of life. The interdisciplinary program Breathe Easier utilizes secondary and tertiary prevention strategies to optimize care of participants with COPD. The goal of secondary prevention is to either identify and cure a disease at a very early stage or slow progression to prevent complications and limit disability. Examples of some of these strategies are listed on this slide. Please take a moment to review them.
Tertiary prevention strategies are implemented during the middle or late stages of clinical disease and refer to measures taken to alleviate disability and restore effective functioning. Examples of some tertiary strategies are highlighted on this slide.
The DNP leaders responsible for development of this interdisciplinary program, Breathe Easier, demonstrate innovation, vision, and strategic planning skills during all phases of the program. From inception, program management and decision-making will be essential competencies to ensure program success. Communication skills are critical during all phases of the program. Communicating with participants, key stakeholders, community resources, and consultants requires the project leaders to be forward-thinking and conduits of change.
The ability to motivate others is translated in relationships between the leaders and participants as well as key stakeholders. Adapting to change is an essential skill of the DNP leader and necessary competency for making alterations to the program as needed to ensure continued success.
In summary, COPD places a significant burden on the U.S. healthcare system. This chronic disease affects 16 million Americans. COPD is the third leading cause of death and fourth leading cause of disability in the United States. COPD is the only leading cause of death that has failed to show a decline in the past decade. In response to the COPD National Action Plan, the interdisciplinary program Breathe Easier has been designed to answer the call of Congress and address this significant health problem.
Breathe Easier, designed by DNP leaders at JSU, strategically uses local resources as a cost-effective method of improving the health and quality of life of patients in Jacksonville, Alabama. This novel approach can improve participants' health and quality of life and decrease risk of hospitalizations during exacerbations. Breathe Easier is a win-win for JSU and the local community.
References for this presentation can be found on this slide and the next slide.